Hello everybody. At the outset, I would like to thank Biological E for inviting me to talk on the use of colistin in the critically ill patient. I am Dr. Subhal Dixit. I am a consultant in critical care at the MJM Hospital and Sanjeevan Hospital in Pune, and I am the past president and the past chancellor of the Indian Society of Critical Care Medicine. Colistin, we all know, it is a very useful antibiotic. It is a very old antibiotic which was found out way back in 1949 by a Japanese researcher. Colistin is available in the form of colistin methylated sodium, and colistin basically covers the gram-negative bacteria. Colistin, it belongs to the polymyxin group of antibiotics. The uses of colistin has definitely emerged, and it is very useful for the treatment of gram-negative bacteria into intensive care units, basically for gram-negative community-acquired pneumonias, gram-negative hospital-acquired pneumonias. It can also be used for gram-negative complicated urinary tract infections and also in the cases of ventriculitis. The most important thing is the penetration of colistin. It has got excellent amount of bioavailability, pharmacokinetics as well as pharmacodynamics, and thus colistin is useful in the treatment of all these MDR organisms. Colistin, most importantly, has got nephrotoxicity, and as a result of this nephrotoxicity, the use of colistin had really gone down over a period of time. Now, colistin is mainly available in the form of intravenous injections, but colistin can also be given especially for cystic fibrosis or respiratory tract infections in the form of nebulization. And nebulization is very important because it also helps to maintain the good amount of drug levels into the respiratory tract, and it will also take care of the tracheitis or the tracheobronchitis, which are mainly caused by the resistant gram-negative organisms. The various gram-negative organisms which mainly colistin takes care is mainly the Enterobacteriaceae, the E. coli. They also take care of the NDMs, which are very known, the New Delhi metalloforms which are there, the Pseudomonas, and also the Acinetobacter baumannii, which plays a very big amount of havoc into intensive care units. Colistin is basically given intravenously. It has to be given in the form of a loading dose, given in a loading dose of 9 million units over a period of 1 hour, and after that it is then followed by a dose of 4.5 million units twice a day, depending upon the create clearance. Of course, as I told you, because of the nephrotoxicity, if the create clearance is less than 50 ml, then definitely dose adjustments are required depending upon the creatinine clearance. They have to be diluted, and it has to be given over a period of 1 hour. That's very important in order to avoid the nephrotoxicity. You need to monitor the creatinine in all these patients where colistin has been started, and it is best to give them as a part of syringe pump, as a part of infusion over syringe pump, which plays a very important role. As I told, it has got very excellent amount of activity against the MDR Pseudomonas as well as Acinetobacter baumannii. It has also got enhanced amount of eradication with Acinetobacter baumannii, which is caused into the respiratory tract, and a combination of giving colistin along with a carbapenem antibiotic definitely ensures better amount of clinical outcomes in those patients where you have got a MDR gram-negative organisms. So definitely, I would definitely recommend that because of the potent activity and because of the wide spectrum of coverage because of colistin and the excellent amount of coverage because of the activity against the MDR pathogens, definitely colistin has got favorable clinical responses in pneumonia. Colistin therapy is a very important bloodstream infections or complicated sepsis, and also of the sepsis of the lower respiratory tract or complicated urinary tract infections, and also used in patients of ventriculitis. Colistin has shown excellent amount of efficacy in ventilatory associated pneumonias, urinary tract infections, and in patients of sepsis. Colistin plays a very important role, notably in the MDR as well as the XTR strains of Pseudomonas aeruginosa, Acinetobacter baumannii, and also against the Enterobacteriaceae. Regarding Pseudomonas, most important, a synergistic activity of along with carbapenem or cifrazidime has shown have excellent amount of results, and sometimes colistin monotherapy is more suitable than patients in colistin plus meropenem therapy for the treatment of severe infections which are caused by carbapenem resistant gram-negative bacillus. So therefore, ladies and gentlemen, colistin is very useful. It should be used very judiciously. It should be used respecting the cultures. Do not use it as a blind therapy. definitely respect the cultures, because using colistin is one of the most important armamentarium and it has to be used judiciously in order to avoid antibiotic resistance. Always remember that you should know the antibiotics as well as the flora and the sensitivity resistant patterns of your unit. Have a good coordination with the microbiologist, which will tell you whether you are dealing with a colistin resistance or a carbapenem resistance. And in carbapenem resistance, definitely colistin plays a very important role. And mind you, nephrotoxicity is important. Monitor the renal functions in all these patients, and thus use of colistin properly at the right time in the right patient and by the right dose. Monitoring for the nephrotoxicity will help us to save the lives in patients of sepsis and septic shock, and thus reduce the morbidity as well as mortality into critically ill patients. Once again, I thank Biologically for inviting me to give this small presentation, and thank you very much.